The amount of hemoglobin bound to molecular oxygen is determined by oxygen saturation. At a particular point in time, it is a crucial criterion for patient management in a hospital setup. It's measured in arterial oxygen saturation, SaO2, and hemoglobin levels in the blood. Oxygenation of the veins, SvO2, saturation of oxygen in the blood is an important criterion for blood type, oxygen supply, and content. For patients with health problems, measuring oxygen saturation is especially crucial. Circumstances that can cause a drop in blood oxygen levels. These conditions include COPD, asthma, pneumonia, and lung cancer are all examples of chronic obstructive pulmonary diseases. Anemia, heart failure, heart attack, and other cardiopulmonary illnesses are among the most common.
The purpose of taking the oxygen saturation is to estimate the arterial blood oxygen saturation and to detect the presence of hypoxemia before visible signs may develop. Next, for our assessment, we need to determine the best location for a pulse oximeter sensor based on client's age and physical condition. Unless contraindicated, the finger is usually selected for adults. Also, we need to assess the client's overall condition, in which it includes the risk factors for developing hypoxemia, like respiratory disease or cardiac disease. Also, the hemoglobin level of our patient. Take note of the client's vital signs, skin color, temperature, nail bed color, and tissue perfusion of extremities as baseline data. Lastly, we may want to ask the client if he or she is allergic to any adhesives prior to our procedure. Next, for our planning, most hospitals and clinics have pulse oximeters on hand for use with other vital signs equipments, or sometimes as an integral part of an electronic blood pressure monitoring during the planning process. But however, some facilities may only have a limited number of oximeters on hand. For the equipment that we will be needing in assessing oxygen saturation, we have the nail polish remover or the acetone that is responsible in removing the nail polish of our patient for us to prevent the distortion of measurement and our oxygen saturation. Next is we also have the pulse oximeter, in which it is responsible for measuring the oxygen level of our patient.
Good morning, Mom. I'm Kimberly Liwanag, and I will be your nursing student for today. I'll just clarify your information before we begin with our assessment.
Sure.
So you are Kayceline Damian, 22 years old. You're living in Concepcion, Tarlac.
Yes.
Today, Mom, I'll check your oxygen saturation, which we allow to calculate ratio of oxyhemoglobin in your blood, which is a circular metric in determining your blood oxygen and content and delivery. We will also be able to detect the presence of hypoxemia before any apparent indicator appear as a result of this assessment. Mom, may I ask you if you are allergic in adhesive?
No.
And now we will place the pulse oximeter on the client's finger. Sir, may I? So middle and the index finger are the best location for the pulse oximeter to be placed. And we have to make sure, or we have to ensure that the light or the waveform on the face of the oximeter is fluctuating with each pulsation. And we will connect the sensor probe to the pulse oximeter and turn on the pulse oximeter, and we have to check for the operation of the equipment. We have to check for the preset limits alarm for the high and low oxygen saturation and pulse rate. And we have to change the alarm limits according to the agency policy. So if indicated, we can cover the sensor with sheet or towel to block the large amount of light from external source. since bright room light can be sensed by the photodetector and it may alter the oxygen saturation value. Next, we have to compare the pulse rate indicated by the pulse oximeter to the pulse or the radial pulse periodically. The rationale behind this is that a large discrepancy between the two values may indicate a malfunction to the oximeter. Next, we will now remove the pulse oximeter. And we have to inspect if there is a irritation or pressure in the location. And then we have to change the location of an adhesive sensor every 4 hours and every 2 hours for spring tension sensor. We will now clean the non-disposable pulse oximeter according to the manufacturer direction and we will perform hand hygiene.
Evaluation. Compare the oxygen saturation to the client's previous oxygen saturation level. Relate to pulse rate and other vital signs. Conduct appropriate follow-up such as notifying the primary care provider, adjusting oxygen therapy, or providing breathing treatment.